As healthcare providers and researchers, it's essential to engage patient perspectives to advance health outcomes and policies. But how do we incorporate patients' perspectives in research prioritization? That's where we came in. Here in the USC Patient Engagement Studio, we came up with a novel way that helps researchers obtain information from patient communities and identify their research priorities. In this project, we worked with a group of patient experts who all either were experiencing long COVID symptoms or were the caregiver to someone with long COVID symptoms, and we followed a three-step approach to discover their research priorities. As a side note, in the Patient Engagement Studio, we give the title Patient Expert to those patients, caregivers, or other stakeholders who have completed our training sessions in team building, communication, and the basics of research. Now back to our process to discover research priorities. The first step occurred during the training and team building for our future patient experts. All the training sessions were held using video conferencing software, and we would listen to the patient community's potential questions as to why they got sick, how their condition might progress, what treatments might work for someone like them, or other wonderings about their condition. From these questions and wonderings, we created a short electronic survey asking the patients to identify the top 5 populations, interventions, exposures, and outcomes that were the highest priority for this patient community. Next, the data from the survey was used to create 10 research questions that were sent to the patient experts and asked them 3 things. 1. Select their top 5 research questions from the list of 10. 2. Rank order those questions. And 3. Distribute 1 million fictional grant dollars between their chosen 5 questions. We analyzed the results, and here are the top 3 research questions identified by the patients. 1. In people with long COVID who experience brain fog, cognitive changes, is hyperbaric oxygen therapy more effective than neurological brain rehabilitation at improving cognitive outcomes and quality of life for patients after 6 to 12 months of treatment? 2. Which complementary and integrative health approach is most effective for improving long COVID symptoms, natural remedies, mind-body therapies, or a combination of both? And 3. Are adults with multiple SARS-CoV-2 infections more likely to develop long-haul COVID compared to those who only experienced one SARS-CoV-2 infection? Through this process, we discovered that our patient experts' interests and curiosities surrounding their health conditions can be explored and refined through a stepwise process to produce realistic and investigable research questions. Effective collaboration between researchers and patient communities allows for the development of improved health policies and research outcomes. Our novel methodology ensures contemporary community ideas are considered at every step of the research prioritization process, and that funding opportunities are centered around the community's best interests. Through a patient-centered methodology, patient wonderings can be transformed into research questions that drive healthcare outcomes and policies that are in the best interest of the patient community.